Good morning, everyone. Can I welcome you to this meeting of the Employment Committee on Thursday, the 1st of February. Can I welcome Andrew Stewart to his first Employment Committee meeting in post. So good morning, very closely knit human resources team over there on that side of the room. So it's, yeah, that's good. No, welcome indeed. As usual, the meeting is being broadcast live on YouTube and will be available for viewing after the meeting. The link is available on the Council's website. Can I please ask that all members and officers have their microphones on mute until they wish or are invited to speak? We have, in fact, yes, we have someone on screen today. So can I ask that officers show their cameras only when presenting reports and answering questions? I have received apologies today from Mr. Pendleton and Mr. Shepherd, and we have Mrs. Seaton and Mr. Bannister as substitutes. So good morning to you both, and thanks for covering. Item 1 on the agenda, we need to confirm the minutes of the meeting held on 7th of December 2024. These are on pages 3 to 8 of your agenda packs. Are members happy that they're a true reflection of the meeting that took place? Thank you. Okay, I shall sign those after. Item 2, question times. I've received no questions from members of the public. Item 3, questions asked by members under Standing Orders 7.3 and 7.5. Again, I've received no questions from members. Item 4, urgent items. I've not been notified of any urgent items we need to deal with today. Item 5, declarations of interest. Does anyone have any interest in respect of any items on the agenda today? No, thank you. No declarations on that. Item 6, presentation of petitions under Standing Order 35. We have no petitions presented today. So that moves us to item 7, which is our first report on attendant management. This is on pages 9 to 14 of the agenda pack. Andrea Denham, who's our HR business partner, will present the report. Andrea, over to yourself. Thank you.
Thank you, Chair. So starting at the top of page 9, so this report is to bring the committee an update on the sickness absence position at the end of December, which is Q3 for 23-24, and to talk about the next steps of the attendance management campaign, which was delivered in November 23. Just for background, the last committee was on the 7th of December, where we discussed the Q2 position, which was the end of September, and we discussed the details of the comms campaign. And for those of you that were at that committee, you'll remember that I sent a follow-up link for some videos and the comms information. So I hope that you've had the opportunity to access that and digest that. So at the end of the report, if you've got questions about that, we can have a discussion about that as well. So moving on to point 4 is the table, which we've got the last 4 years end of year position, and also the 12-month position for Q1, 2 and 3 for 23-24. And then for this Q3 position, we've got the total FTE days lost for that 12-month position, as well as an estimated total cost for that period for each of the departments. And over the page onto page 10, we've got the LCC total, and then we've also got the ESPO and the EMS position. So as you will see, at the end of Q3, we have the chief executives and public health departments are below our 7.5 day total. We have children and families department, environment and transport, public health, and also ESPO, who've made improvements from Q2 to Q3, which is a positive indication. We're currently at 9.62 days FTE days lost per FTE, which is an improvement of 0.18 from the previous quarter. So an improved trajectory, but obviously there is still lots of work to be done to move towards that 7.5 day total. Moving on to point 8, we move into our reasons for absence at the corporate level, and we have the 10 highest reasons for absence lost, plus the not disclosed category. And then I've got some commentary obviously falling on into the next few points. So the levels of mental health absence from Q2 to Q3, that there has been a slight increase. I'm not sure that it's a significant change, and I think what we're seeing, if you look across those numbers, is it's kind of going up and down a little bit over those periods, but there's not any big significant changes. And what we know is that this is our main reason for lost time across the council. Over the page, onto page 11. In May 2003, we had a more detailed discussion around the not disclosed category, and the committee members at that time asked me to have some focused work across all of the departments looking at that particular category, which we've been doing at a variety of levels with various different officers. And I hope that you will be pleased to see that that category has been seeing period on period improvements. Obviously, we're continuing that work on the ground and with our senior management teams to push that as an improvement. But I know that I'm pleased to see that we are making some really good improvements in the areas where we need to capture that data more accurately and move that not disclosed into proper reasons for absence, so we've got that data available. On the 7th of December, we set out in the tables below on the 7th of December, there was a request that we provide some trends of the reasons for absence by departments, if you remember, if you were at that committee. So previously I'd brought a kind of snapshot of what the trends looked like, what the picture in departments were by reasons, and I was asked to bring some trending information. What I've done is I've brought the core reasons across departments. Obviously those reasons are slightly different, so I've picked some of the core reasons and then I've shown them across all of the departments for these are 12-month periods across three end quarter positions. So I thought this was probably the best way to give you some manageable amount of data to be able to see some trends. What I've commented on below is mental health appears to have seen an increase in the majority of departments, as you can see over those 3 periods, and it is still the main cause of time lost in Children and Families Department, which was the observation that we made last time. And also one of the positive things that I've noticed and is a reflection of work that we've been carried out is that resources previously, and we've been doing a lot of targeted work in corporate resources, particularly in school food, to improve that, and that can be shown in the amount of not disclosed absence in corporate resources. So I'm really pleased to be able to report to that here today that that's improved, and I think that then shows through in the corporate figure on the previous page. Moving on to page 12, we have the long and short term split for the end of December position for the 12 months. This is looking very much like how we usually expect it in the majority of departments. Obviously in the bigger departments, it's generally kind of a 60-40 split. It does sometimes move around a little bit, but the majority of our absence is long term. As I say, there are, public health, it's a little different at the moment, but it does tend to, in the smaller departments, so public health, chief execs, it can sometimes be 50-50, but the bigger departments tends to be sort of 60-40. And then moving on to the service level data, we've got the last 5 years plus the quarters 1, 2 and 3. I have also noticed, and I apologise for it, I have made an error on one of the numbers. So if you have a particular focus on environment and transport, on the environment and waste line, I've put 111.18. It should be 11.48. So it probably stuck out like a sore thumb. So I apologise for that. Obviously my finger slipped and I've entered the wrong number when I've transferred the numbers. So apologies, that is an error. So that looks, so 11.48 obviously looks like a much better figure to have on that line. And I double checked that again this morning, and that is correct, the number that I should have put in. Moving on to point 16, the corporate attendance management communications campaign. We discussed it at the committee on the 7th of December, and it was delivered in November, and it delivered messages at all all levels of our management, so senior managers, middle managers, and also to our workforce, to our staff, really delivering messages around well-being and around good attendance. What does it look like? Also, what are the expectations for all of those different levels in terms of what do we expect them to do practically? And I hope that you found that when you went in and accessed those resources that I sent through to you. So what are we doing now? So following on from that campaign, we have a small team of 3 performance management advisors that sit within People Services. What they're doing is within their casework, so they work with our most complex and long-term cases. They're continuing to signpost to those resources. So we know that we've got those curated resources on the intranet. They're continuing to refer people back into all of those resources, and within all of the emails, they're signposting, continuing to reuse them. So we're getting the best out of that work that we've done, so we don't lose the value of that, because that's a good basis for them to continue to drive all the work that they're doing. Also at point A, attendance management training for managers. It's a real key focus. We need to make sure that the skills of our managers are really high and they've got the confidence to be able to have good conversations about attendance and well-being. We know that prevention is the best way of preventing sickness absence and preventing long-term sickness absence. Off the back of the campaign, we've had increased demand. We anticipated that. We've increased the amount of courses. I've put some numbers into the report, which I'll allow you to access by reading, but we've got a high number of that mandatory training course complete. We're at 75, but it's not good enough. We need to push up into the 90s with that. So, and as you'll see from the report, we've still got sort of over 200 managers to get through that course. It's a large cohort of people, but we're really focused as a team in being able to get those people through. And as an addition to this, since I've written this report, we have developed and been delivering a shorter course, which is around mental health management, that's being delivered in environment and transport. And from March, we've put that onto our learning hub, so all managers will be able to access that as a top up, as an additional course, and we've been sharing that with our DMTs and with our senior managers to be able to offer that, and our team are now offering that to managers as an additional item for those that want some more confidence around managing mental health absence. So if I just finish with recommendations, the committee is asked to note the update on the current position at the end of December, and obviously any feedback that you have on the current position and the next steps with the campaign.
Yeah, just before, thank you, Andrew. Just before I ask questions to members, just on page 12, the corporate resources, the full-time equivalent at 7,800, presumably that includes traded services. So presumably that's why the figure is as high as it is, because it's obviously not the largest department, but it's got the most full-time equivalent days lost over 12 months cumulative.
That includes.
Thank you. Yes, I thought it was. I mean, to me, it's good information in the report. It's good to see some trends are going up and down. I mean, the only question I'd have back on the attendance management for training for managers, how long are each course? What's the length of the course? Is it a couple of hours or all day? It seems a shame that we can't put that to bed and get all our managers on board with that training having completed. Okay, all right. I think
it's 3 hours long, is my memory.
All right. Members, Barry.
Thank you, Chair. I won't go over the figures because we look at them every quarter and we know where we are, etc. And obviously, in things we've raised before, if you go into the business world, I think we're probably about 5.5 or something like that is the standard. We're 7.5. And we've talked in the past about, well, we know in the business world they're probably a lot harder on the way they deal with people, and that obviously puts some fear into people and take time off. But at the same time, I think at the same time with ourselves, we're more understanding. I get that. I think we have an awful lot in place to help people out, etc. But when you look at the difference in the figures, then you have to start saying, well, and we've talked it before, are we stressing people out too much? And is that what's wrong with this business model compared to outside? Or do we have a culture where people think it's just easier to take time off? In which case, that's something we've got to come down. And I think what we've got to learn from this is that the way the business world handles it probably needs to be used here, but at the same time, we back that up with the support that we have. So because it's the two things that people that genuinely are ill and need all the support they can get. And when I look at the different departments, because since we've split the departments, it's really interesting to see where the stress levels are. I have family members that work in similar sort of fields in other councils, and I know what they're up against. I completely understand why they are as they are and what they're dealing with. But at the same time, we've got to make sure that there isn't a culture of people thinking it's easy to take time off, especially with the working from home thing, etc. So I think with this attendance management course, I'd be honest, I'd be really interested to sit on it myself to actually see what we're doing. I'm quite happy to pop in for a few hours and sit on a course and actually see what it is we're doing, what we're asking our managers to do, because it's very difficult here to appreciate how far are we going? What are we telling people to do? It's carrot and stick, and there are people that genuinely need help and etc. We should do that, but there will always be people that will be swinging the lead as well, and we need to make sure we keep a lid on that. And I think personally, this 7.5 and the 5.5, I think probably 6.5 is where we probably get to, which means we're more understanding in the business world, but we're also hard on people that are pushing things. And I'm really interested to the fact that we're doing this training course and that we're actually got this progress going so we can do it. But what we've got to get to a point is where the culture is people feel ashamed if they were taking time off when they didn't need to. And that only comes from peer pressure, or it comes from the thought that if you're off, you're going to probably get talked to by one of your managers when you get back, and therefore you've got to explain yourself. And that just puts that bit of pressure on people, so that if they're genuine, they've got no problem at all and they'll do it. But if they're not, I guess that's probably the next step. I think we're going in the right direction, but like I say, if it's an opportunity to come and sit on one of those courses, that's okay, Chair. I'd be more than happy to do it.
Okay. A virtual course or in the classroom course? Curious. Yeah, I just want to come back to a couple of the points. I mean, I think and a quote that I never expected to make in an employment committee, but I'll come to that. I think in terms of the expectations that we put on our managers, and this was part of the comms campaign, it's part of the that we're just talking about, the expectations that we put on our managers to proactively manage sickness absence, but more to the point, proactively manage good attendance and create the conditions for good attendance. Realities are high workloads, high pressure environments. We have staff shortages and higher turnover, and we've explored that in previous committees. I'm not going to sit here and give excuses. It is genuine context, and largely genuine illness. We always have people. We're a large, complex organisation of 6,000 people. Will always have people who. It's just the nature of people in organisations. It's how we then deal with that and how managers. The working from home element manage performance and productivity in the same. Wherever the expectations are the same, you might need to just adapt how you have the conversations, how you engage people, etc. How you make sure people are included, heard, etc., and more able to hide, if you like. But those expectations are the same, and we've got lots of support for managers through our Ways of Working programme in looking at organisational culture, setting up the right conditions in teams and services. And the quote, because it just happened, we get daily headlines in an email. So the Daily Star, so that's the one I didn't expect to ever quote, claims pulling a crafty sickie at work is good for people because they help reset and avoid burnout, according to careers expert, claims Robbie Bryan, who's quoted in the tabloid. Research suggests UK workers are pulling more sick days than at any point in the last 10 years. So take that for what it is, and that will be all sectors. And it's a view.
whatever. It was more about actually, if that's happening in any organisation, we may have our share of it. How are we managing it? And that's the emphasis that we put on, as well as supportively managing genuine illness and getting people back to work.
Okay, thanks, Gordon. Linda.
Thank you, Chair. You've actually touched on really what I wanted to say. I think we need to drill down on this mental health and stress levels. Because we need to know, and you perhaps do know, what is actually causing the stress. I, like you, know people who work for this authority who are so stressed because of staff shortages, not enough hours in the day to do what is being asked of them. And I know quite a few people who have left because of it. And it concerns me that we could be losing good staff because of the stress levels and what we can put into place to help workplace stress. I'm not saying all the stress levels are workplace, definitely not, but some of it is. And it's fine with managers asking them to keep doing these courses. But if you look at the whole package of everything that we're asking managers to do, and therefore pass on to the frontline staff, if you like, it's a lot when there's things that like staff shortages, like extra workloads. So I think if we can drill down on certainly the stress and are we causing mental health because of the stress loads that people are under. Please don't get me wrong, I'm not saying that we're causing it all, we're not. But if there is something that we can put in place to help those people and retain staff that are good members of staff, it would be useful to know.
But Peter, then I've got Barry, and then I've got Neil. Thank you. Brenda, thank you.
Okay, thank you, Chair. You know, I appreciate the extra data in this month's report. We discussed last time some trend analysis. I think it's really helpful to see that. Just picking up on one point. Last time we spoke about where there's kind of different levels of performance in terms of absence for different departments. What kind of action plans are being put in place? Because highways and transport still sticks out to me as being one of the directorates where there is a upward trend and it's not shifting. It's going up, but it's not really going back down. So it seems to be, I mean, you pulled out that 111 number and it's the wrong number, but the 11 point whatever it is in that table that relates to environment and waste and highways and transport, if you look at the previous number of years, significantly up, 21-22. So I just wondered what action plans are being worked through with that particular department to understand why there's a trend which is dragging up the average lost time and how we can bring that back down.
So in terms of the departmental approaches to obviously the different figures, those are being discussed within their department management teams. And I haven't to this point asked them for updates to bring to Employment Committee, which I can do. My understanding, because Environment Transport isn't one of my personal departments that I work with, but my understanding from my colleague who works with Environment and Transport is that there are multiple factors which I understand which have they believe have led to their increases in absence, some of which are recruitment and retention based. I think they've seen more mental health absence, which has crept in. So I think it's a multitude of. I think they are working on their retention issues with various approaches to that, and then they've also had some targeted interventions with their managers around upskilling in terms of their ability to work with mental health cases. But I can definitely bring an update in terms of specifically doing
Just briefly, yeah, I think that'd be really helpful to have that next time. I think how I would see it working is, you know, each department would have their own action plans around bringing down, and then regular report listing we have every single meeting, a regular report of how they're doing against their action plan. So they've got an action plan, they're going to do this, this, and this because they realise that this, and this are the issues. How are they actually improving?
Useful to say Barry does attend the attendance management training, so there's a knowledge within the committee of the expectation that's based on managers. So Barry, you have another question.
Thank you, Chair. I think, I mean, I've been on this committee what, two and a half years now, kind of 3, and I'm starting to understand this more as we come. And we've seen this paper develop and more information coming through, so we've started to get an understanding what departments, that kind of thing. I think as you move forward now, because it's funny actually, it's not until we sat down here, my colleague that's subbing was a bit shocked about the cost of the amount, and it kind of nudges you because you get used to these figures, and when somebody new comes on and they look at it and you think, yeah, that's exactly what I thought when I first started looking at the papers. So I do think we're getting somewhere in the reporting and everything else. And moving on to the next stages and picking up from Peter, what we're saying, looking at an action plan, is also looking at what's some of the causes that we could actually look at. So, for instance, say I know someone working in an organisation working on HCPs. You can imagine the stress levels. I see them working from home. I see their stress levels. I see what causes it when they have staff shortages, when they're losing people, and that, etc., etc. And in some ways, it's trying to get that information back in, so that if we know that 26 people in a specific area have problems, what's the reason for that? Is what I'm still trying to drill down onto. And we've talked about this many times, is it us causing stress? But I guess what I'd like to see at some stages with the reports coming through saying, yeah, we've analysed this department and we are understaffed by 10 people. And that's the reason why we've got these problems. So it isn't a case of us sitting here and trying to beat people up and saying, why aren't people coming to work, etc. We can actually turn around and say, yeah, we're 10 people, sure. And we take that on the chin. And either we've got the finances to deal with that or we haven't. If we haven't, then we accept what we've got. If we have got it or we can do something, then we can do it. And then when you put that money, say, into that department to resource as you need to, if you don't start to see figures coming down, then you know you've got to drill down on that more. But I think we're getting there to analyse where the problems are and what's causing them. Now we've got to really seriously look at what actually do you do to change it. We can't just keep coming back every 3 months looking at some figures to see they've moved 0.18%, which has given us a £9,500 saving. We've got to actually look at, you know, we might want to spend 100,000 to save ourselves £1 million. Thank you, Chair.
Thank you. Yeah.
Yeah, just a thought on that, because I think in the past we've had particular focus from time to time on individual departments. I think my caution would be that if we go down to an individual service level and start to analyse, you know, what might be a smallish part of a service in a public meeting, that could just get a little bit, you know, you have to be a little bit careful around the data. But we could certainly focus on a particular department in the future. We've done that before, not for quite a while, and I think I'd feel comfortable at that departmental. It might not give you quite what you're looking for, but I think what you're talking about is what we require managers to do. So, you know, heads of service, team managers, etc., to try and understand whether there's anything happening at a team or service level, as well as individual, because, you know, everybody's off for different reasons. It's sometimes, and often it's a mix of personal and work related, if we're talking about, you know, stress, for example. But sometimes there are, you've said, you know, there are organisational patterns. Again, I'd be cautious about how far to get into those in a public meeting at a small service level, but we could do that. Repeat myself.
But yeah, we can check that. So, yeah. If not, we could always do it by a workshop, as I guess. We could do something outside of the committee itself. So, all right, yeah. Okay, thank you. Thank you. Neil, you had a question.
Thank you. It's really just following on from what Barry had said. Barry's really covered much of the points that I was going to make, but I was wondering whether or not there had been any sort of piece of work where in a particular department the level of stress can be related to a very large casework that they're having to carry. They have time off because of that casework stress. And when they come back, that casework stress hasn't gone away, it's still there. And I was just wondering whether there's been a piece of work done to examine the cost of having that person off ill quite some time, or other individuals off ill, as opposed to the cost of employing some extra staff to assist in order to hopefully prevent that sort of illness from going short to long term.
It's fair to say a lot of it is because it's specialist sort of social care placements. It's just a shortage generally of being able to get in locums and temps. But I don't know whether the officers want to sort of confirm or deny that.
Yeah, if I can answer that, you've said exactly what I was about to say. Often it's a very complex system whereby if there were available staff that we could employ, then that may be an option. Often the solution to backfilling absent staff is agency, who are very expensive. So then the balance of the finances becomes a very difficult balance. I think in an ideal world, we would want to have able to employ directly employed staff, which would obviously cost us a reasonable amount of money, which would then be the perfect balance. But often the pressure points are in our services where we struggle to recruit. So we know in waste services, we struggle to recruit. In social care, we struggle to recruit. And these can often be the places where we have some absence peaks and troughs. So I think these are often issues. I think also what the other thing that I would comment is that we have people who are managing high workloads and high amounts of work pressure who are not absent and who are continuing to work and manage in very difficult work circumstances. And then we know that I did a study time ago across adults and children's, looking specifically at the mental health cases. And when we broke down those mental health cases, what we found was that the majority of them were actually a mix of causes. So it was that they had out of work in their life, and then work on top of those things. It was a, I suppose in my words, it would be like an overwhelm of issues. So I think what we know is that people are complex, people are all different, and actually people's ability to be able to cope with multiple things. There are always people whereby it's completely work, and some people where it's completely out of work. We know that out of that study, we found that bereavement was a big issue for people. And we know that bereavement's one of those issues that can affect you your whole life. Out of that, we know that we've put in loads of support and groups for bereavement support, and those have been really welcome. Have helped people stay in work, So we sometimes forget all the things that we've done that are preventative because they haven't ended up on the report because people haven't taken absence. But there is always so much work for us to do, and I'll take on board all of the things you've said about further analysis. We know that we have in-work risk assessments for people, which give us lots of information about workloads, and we know that there is loads of work that we need to do. I work with children's services, and we are currently looking at how we might look at our staffing model and if we want to recruit to help manage potential peaks and troughs. Then we will look.
It was just a real quick around the cost. A number of years ago, we added the total cost of absence to this report very deliberately, because I think it's kind of often a hidden cost. Somebody's just off for a little while, a hidden cost. So these figures are a mix of actual replacement costs, where we, us off, we need to get somebody in to replace them or pay an agency, and opportunity cost. So that's the kind of hidden cost element, but it is still a cost. And we've said before, and I'm not necessarily proposing this because figures aren't going down, but if we went down by X days, impact would that have on the size of the workforce we needed? That's kind of a bit up in the air at the moment. Well, sicknesses at this.
Right, I've got Brenda, then I've got Bertie, and then finally I'll take the last question from Linda. So, okay.
Thank you, Chair. I think Andrea's just sort of broached how I wanted to come to the subject of mental health. There's just so many factors in mental health, and you cannot departmentalise them. They're a cumulative impact on you. And if we could separate our work life from our personal life, it would be absolutely amazing, wouldn't it? And that's taking control of our mental health. But last night on the news, I was doing some sewing, so I wasn't particularly paying attention, but there was quite a thing on loneliness and women's groups being started up because they're working from home and they're very lonely. And I've just Googled it because reading it might have been better than me not paying attention while I was sewing. It says loneliness has working from home left you feeling isolated, and there's a whole load of media coverage on this from that's been sparked from last night, I suppose, on the news. And I mean, I've always found, I've retired now from my main job, but there was nothing like going into the staff room and talking to Annette next to me, complaining about her husband. And you're listening to her and you think, well, actually, my husband's not so bad then, is he? Or complaining about not being able to buy a new pair of shoes for the son or for the children. And I'm a big believer in that community, that communication between people. It stops you making mountains out of molehills. And we've lost that ability now because we're working from home. So is there any way you can home down on the mental stress to people that are working from home and those that are working in office? Is there any way, or are they doing both things? I don't know, but it's clearly from the figures that something has got to be done on this. It's not going to get better. It's unless we do something to improve it, and it's probably employing somebody or have some. I know you do sessions because I do look on. Yeah, that there are sessions that you do during lunch breaks, isn't there, of groups that can meet for certain things. Are they done because of the mental stress, or how have they come about, these little meetings? Is that something that you have developed to impact on it? Thank you.
Yeah, that's okay. That's an interesting aspect of it. So yeah, please, Gordon.
Yeah, no, that's really helpful, and I think we've always had quite a rounded wellbeing offer, and that can be the ad hoc lunchtime session to a more structured counsellors, etc. Everything in between. That came into sharp focus during COVID. For reasons, we kind of revised the offer. We put a lot of emphasis on various aspects, and what we've tried to do since then is keep the best of and kind of adjust to a changing organisation, but also a changing world. The stresses that people have, etc. So there's a whole range of things that we do. But if I put my leading the Ways of Working programme hat on. There's a core bit for me, which is around, we produced a really simple manager's charter during COVID, which was about keeping in touch, checking in, really understanding where people were, doing what we could to make sure people were included. It is just as relevant now. We've got nobody contracted to work from home full time. People should be hybrid, should be working in a workplace for part of their time. And there's a lot of emphasis we put the training and the coaching for managers to find that balance, to bring people into the workplace for the right reasons, not just to come in and sit in a corner on Teams calls all day. They may as well do that remotely, but to come in to mix with colleagues, whatever the examples are. And I imagine there are parts of the organisation still trying things out, not getting that quite right, struggling to get some people in. Let's be honest about it. But we need to keep on that journey and find the sort of. Sorry, Andrea, I don't know if you.
Okay, Chair. I think if I look, I suppose, in terms of evidence, the place that I would go to is our staff survey. So I'm assuming that you can all access the staff survey results. If you look at our staff survey results, some of the most positive results that we have are around ways of working, being able to work in a hybrid way, and actually those are the things that have had the most positive impact on people's well-being and that choice, and people being able to come in and collaborate and being able to work from home and do focused time. I think if you look into the staff survey results and you speak to people, that's what they're actually doing. I don't feel we're in a position where we're forcing people to work in a isolated way because they're having to come in and out. And actually when they come in and they collaborate, they're doing it in a way where they're working with people. I know anecdotally from the way that my team, even when I am working at home, I know we're in and out of each other's, we're ringing each other, we're talking to it, even when I'm working from home, I'm never isolated. I'm constantly speaking to different colleagues. I'm constantly being messaged by various customers. It's even working from home. It's not. It's people have got very used to all of the technology now. I'm sure there's some people who will be struggling with it, but we are, as an organisation, getting much more used to. Even some pockets of my customers within the organisation who I thought would be slower to pick it up are getting really, really good at using all the technology and all of the new equipment and actually the collaboration and the mixed way of working. So what I would say is try to have some confidence that actually we are getting really good at doing this, and actually we are making this we are making this a good experience for people in terms of hybrid working. Isolating people, we are bringing people.
The question I would have wanted to ask you, and I'm not going to ask you obviously, but I'm going to say the question: have you been off because of mental health? And I don't. It's a hypothetical question to ask. You're talking as if everybody's off with mental health, and they're not. So that the person that is off with that doesn't know why they're stressed. And if I was a stressed person, coming from a standpoint of I've not had any problems, I'm a very balanced person, and that's so lucky, and I know that. So I'm coming from a position of not fully understanding what depression and mental health is. And I think the majority of us also come from that position, that it's not took over our lives. But if I was that sort of person, if I had got those problems and you said to me, do you want to come in or work from home? I'd say, I'm going to work from home. I don't feel like having a shower this morning. I don't feel like drying my hair or cleaning my teeth. I'd just rather work from home. But I think the impulse of us wanting to get on with people, to make a good impression, makes you have that shower in the morning and do your hair and put your makeup on and get into work on time. I'm just saying that if I was that sort of person, I would say in a survey, oh yeah, working from home is brilliant. Whereas probably it would be better for me to come in to work. Do you understand what I mean? I think it would be better for me to have that somebody say to me, well, you've got to come in, and that's that. I think a little bit of saying, I think you were avoiding saying that we're a little bit soft. We're a bit too understanding, and we're a bit too guided by those surveys that people lie on. And probably we ought to try something else to be able to bring that down. Again, I'm just ranting, and I'm just trying to think of a point of view. I'd rather stay at home. If I wasn't very well, if I had concerns and worries, I'd rather stay at home with them than come into work. So probably giving me that choice really takes the choice away from me.
Hey, thanks, Brenda. Yeah, I don't know whether you just want to come back on that too.
Yeah. So obviously I talked about a training course that we're currently running around mental health, and I think obviously we do have employees who fall into poor mental health, and I think what you're describing is somebody who is experiencing a poor mental health episode, and what they might do is they might withdraw. And I think what we will teach a manager is how to deal with seeing what are the signs of somebody who's falling into poor mental health and how to manage that. And what we would do is we would teach them how to try and pull that person back and engage them. And I think there's a middle ground between bringing somebody full-time back into the office, because that might push them to go to the doctor. How do we bring them back and bring them back into periods of time back into the office where they can feel engaged and actually doing something positive and useful in a collaboration space, actually spending some quality time with their colleagues, doing something that gives them that positive feeling about work, but then spending some time at home to do some focused work and building them back up into confidence when they might be having a period of mental health. So I think it's a balance between, no, we don't. If we see somebody falling into poor mental health, we don't ignore it and go, no, stay away, you're on your own, because that's detrimental to them. But at the same time, we wouldn't necessarily bring them full time back into the office, because that might then push them to then go and get signed off. It's always that middle ground, but there's some skill in that and how we manage that. And that's what we need to teach the managers, how to manage that. Because again, as we've said, different person, different reactions. How do we have those conversations sensitively to get the best out of that person and help them get the right help, because they might need to see their doctor, and get them back into work in a safe way that's right for them.
Yeah, thank you. Bertie.
Picking me up, perfect. Yeah, thank you very much for the table on table 11, because I know we discussed that on the 7th of December meeting. I was wondering, as with 15, whether we could start to look back as well and maybe get 5 years of data sitting behind that. Because at the moment we've only got this year in terms of how that's correlated with the core departments and absence reasons. So that's the first point for the next meeting, if that's possible. Second point is, we do often have quite a lot of quantitative data at these meetings with statistics and numbers, and we do then come and talk about the reasons behind that. Would we be able to also get some reasons written down in the report as to why managers think within that department stress might be high? Or some reasons which might be within the council's control, because obviously it's not always going to be within our control, those reasons, but actually having them, I think, then written down for the next meeting as well would then help, because I know we talk about it a lot, but we're not actually putting it on paper within the report, and then from that we might be able to find actually, you know, there's these core reasons, and then that might help targeting and supporting our staff.
Gordon. Yeah, I wonder that just that latter point you've picked up, whether the way we do that is if we've got to focus on a particular department, that will get us into looking at organisational pressures, crisis reasons, whatever, you know, whatever they may be. And that might be the way to do that rather than trying to do that across the piece. So if we perhaps do it as maybe a deep dive in one department, that help.
You might come. Sorry, Bertie. Sorry.
Yeah, because it's a huge workload to go and do that across all departments. So maybe it's something for the chair to decide in the committee which department we want to focus on and do that in.
I think there was a conversation earlier about environment and transport. Perhaps we look at that one and just bring some figures to the next meeting. We just do a bit of a deeper dive into that. So if we start off there and just see what that sort of brings us, and whether we then continue that on a department by department basis over periods. So, thank you, Linda.
Yeah, a couple of points actually. Now, my daughter works for this authority. She's got 4 children. And obviously my other daughter is seriously ill, as most of you know. So she is stressed. She's also stressed at work because of staffing shortages. But actually, what she said to me the other day was, when we were talking about how we could solve problems at home, was that she needed to come into work because she's not just my daughter or a mum. She's likes talking to work colleagues, she feels. So I think that your policy of hybrid working, and you can do some from work, some from home, some from work, works for a lot of people. It certainly works for my daughter, being able to do that. So I think we're on the right track with that. What, you know, she does suffer with depression, but by coming to work actually helps her depression, because she's got something to take her away from any other problems that we have at home, that she can then concentrate on what she's doing at work. She feels useful, which, you know, it is a good thing. But what does add, not necessarily to her stress, but to other people's stress, is the short staff. And I know we've talked about if it's a social worker, it's difficult to recruit, and there are jobs that are difficult to recruit, but there are also jobs that aren't so difficult to recruit. Is our recruitment policy taking too long? I'm just thinking that sometimes a job's advertised and it's a few weeks before we interview people, we do this, we do that. Yes, some people have to have checks up on whether they're suitable and whatever. But is there a possibility of us being able to shorten the recruitment for people that aren't key workers, like social workers and things? I'm just thinking that would then could alleviate some of the stress for these people, and therefore they don't have to go off.
Thanks, Linda. Gordon.
Yeah, just to answer a couple of points, and just in terms of hybrid working, this is where we put the emphasis. Sorry, I'm a bit like a broken record here. Emphasis on managers to have those conversations, and what's right for the business first, but also what's right for individuals. And we do have some colleagues who are in the office or an office full time, because that works for them, for their mental health, or their home setup isn't appropriate for them to work from home. And we've had people who were in the office all through COVID. So we do have different arrangements. In terms of recruitment, we are trying to speed up our processes and become less clunky. I think I was looking at the forward plan, and I think we've got something on recruitment and retention, hopefully coming in May to the May meeting, so we can explore it a bit more. But just to give a couple of examples, you know, moving to CVs rather than traditional application forms. We've also had environment and transport. They've had a couple of open days for particular, you know, local people applying for posts where, you know, lower level posts where people are more likely to be local, and recruited people on the day, and then done the background checks and the forms, etc. So there's various things we're trying to do, but that can be explored a bit more.
Thanks, Gordon. I'll just thank members. I mean, it is good to talk, as they say, and I think we've just had some good conversations, some good questions, and some good suggestions going forward. So we sort of improve what Employment Committee want to see coming to it, and I think next month we can start. Next meeting we can start that. So look forward. We're asked to note the update provided on the Council's overall position on sickness absence as at the end of December 23. Does everyone agree? Okay, thank you. Item 8 is our second item on the report, which is the gender pay gap on pages 15 to 24 of the agenda pack, and Sarah Short, our HR Services Manager, will present the report. Sarah, thank you.
Thank you. The report is to provide the committee with the results of the gender pay gap prior to publishing on the gov.uk government website. The gender pay gap reporting is a statutory requirement under the Equality Act, and the results in the report are for the period the 1st of April 2022 to the 30th of 2023, and we have to publish the results by the 30th of March this year. The results indicate a fall in the mean gender pay gap since March 2022 from 11% then to 9% now, but a slight increase in the median gender pay gap from 8% to 9%. And the explanation for this is linked to an increase in women in our lower quartiles and a slight fall in women in has moved that median figure very, very slightly. There are some comparative figures in Appendix 2, but I always go back in just before this committee to see what other councils have reported intervening period. And since the time of writing, Leicester City Council has reported their gender pay gap figures for the same period, and has been, as has been in the case previously, they are reporting a positive gap both for the median and the mean, although they do represent a very slight decrease in the previous year. So the mean Leicester City is very marginal, 2% difference, and in terms of the mean pay. Again, looking at the comparator data, it reinforces our previous year's reports, and that a significant proportion of our workforce in the lower quartile is female compared with some of our comparator. That lower quartile is up to grade 6. That includes roles such as school food and also roles in home care. Those roles may be outsourced in other counties. So moving on to some of the work that we're doing in terms of gender in the authority. The County Council continues to support the workforce in a number of ways. Springboard and Spring Forward programmes. And the report indicates the good attendance rates that we've continued to have on those programmes. There is an evaluation that is done as part of our Aspiring Managers programme at the end of the course, and the last cohort indicated that 12 of those had gone on to find a management position as a result of attending that programme. So that's very, very positive. That programme in itself also sees a high percentage. We have also maintained our status as a menopause-friendly employer. And again, there are figures in the report about the attendance on training and awareness for both employees and managers. And that training continues to attract a wide range of participants. And work's going to commence this year on policies linked to support menstruation, which is linked to the government priorities health. So that's all I wanted to say by way of introduction. The recommendation is for the committee to vote the content, support publication, results by the 30th.
Thank you, Sarah. Barry.
Thank you, Chair. As you mentioned, other councils, when you try to compare, they'll have a higher number of people working, higher number of males working at a lower quartile, etc. I'd quite be interested, Chair, with these figures to see a set that are altered to balance us up as if we were like another council, that we had lower quartiles with more men in them, and what that would do to our figures. Because when I read this report, and it kind of all pushes towards one thing about making sure that females are being pushed up the ladder, which is fantastic. But it comes across to me that we don't employ enough men in the lower levels. But the thing is like my wife works in the nursery. It is 95% women that work in a child's nursery. That's just normal. My son works in the nursery, so he's one of the ones that the small 5%. But it's just accepted that that's the sort of industry that females want to work in and males don't so much. And if that's just the case, that's how we are and that's what we do and that's the people we attract, then we just accept that. But I kind of feel like we're kicking ourselves constantly because we're pushing the glass ceiling at one end, but I kind of think we're ignoring the fact that either as an organisation we're not employing enough men in the lower areas, or at the least let's balance the figures up so that we can understand, keep comparing ourselves to another council just because they have a lot more men working in lower quartiles. Because in reality, once you balance those figures up, you might find we're doing quite well.
Sorry.
Yeah,
Sarah.
if I can respond to that. In terms of the comparator data, in terms of the comparator data, it's always a bit of a challenge because, as I've said, as part of the report, the date for publication. So when in writing this report, I have a look at which other councils have. I think what I can suggest in terms of that is we will back or separate report in May, which is the results of our equal. So by that point, all councils will have had to report and go back and do a bit of this and see what we have got at that point, see whether there are marital organisations that look similar to ours. So I can certainly do that in terms of the May report. On the point in terms of gender split in some of those roles, we do have some roles in the organisation which do retain a sort of more of a traditional. That is the reality. But obviously we do a lot of work, and again the work that just mentioned that was also coming to that committee around people from. We do use a statement on our adverts where people are underrepresented in fact a broader range. So we can up as part of that work as well.
Peter.
Yeah, thank you for the report. I mean, I get involved in some of this stuff in my day job in terms of ensuring the data behind the kind of gender, ethnicity, CEO pay gap ratios and all the rest of it. So I know it's a tricky data exercise, bringing it all together and having to weigh it all up. So to empathise with you on that. And just a comment really around interpreting the data. I think as Barry said, and I think as Sarah said in her presentation, there were so many different factors that I think shouldn't necessarily focus on one and say that's the reason for a closing or widening gap. You know, I think you mentioned around some councils outsource certain functions, therefore you can't have a direct comparison. There are other factors involved as well, where you say that the mix at different levels. I know in the organisation that I work for, the senior management team, the CEO, the CFO, the senior leaders are female. So it skews it, if you like, one way. And actually, if you just take the average, accurate picture. So I think with all things, you know, lies, damn lies, and statistics, I think we need to be a bit careful how we interpret the data, because I think conclusions that are there that perhaps aren't there. And the second point, really, I'd just like is around sure that obviously we always appoint the right people on merit. It should never be because of a certain race or a certain sex or whatever. It should always be they are the best person for that job. But what I do believe we could do to encourage demographics that are maybe underrepresented is to, through recruitment fairs and things like that, we kind of encourage more people from those different demographics to apply. I think that's the way. For certain jobs, therefore the chances are you're going to get more women in those jobs. You should never be skewing employment of people based on any individual characteristics.
Yeah, thank you for your empathy around the data. That's much appreciated. In terms of that, I think in terms of the reasons are complex because, and again, we have lots of different areas of work which attract people from backgrounds. So and again, and to big up my own report, but the report that's coming back in May on the pay audit will have a little bit more of that detail in there. So we're just starting to analyse that data at the moment. So by the time we've done that analysis, we may be able to come back and some of the here today. And again, in terms of the recruitment, yes, we're very much going down the route of action in terms of encouraging people to see us as an employer of choice, and that's what we want to see. But yes, the recruitment is robust and is about I
have no more indications for questions, so can I thank you for the report? And we're asked to note the content of the report and support the publication of the gender pay gap by 30th of March 2024. Does everyone agree? Okay, thank you. Agenda item 9 is our final report, which is on the organisational change policy and procedure action plans, pages 25 to 30 of the agenda pack. Damien Buckley, Democratic Services Officer, will present the report. Thank you, Damien.
Thank you, Chair. This report presents the Council's current action plans and also ongoing action plans, which contain provision for compulsory redundancy and details of progress. There's 2 appendices also that detail these. Members are just asked to note the report and the contents of the appendices.
So we are asked no questions, so we're asked to note the update provided on the action plans which do contain the provision for compulsory redundancy, the details of progress in their implementation. Everyone happy and agree? Okay, thank you. Item 10, as mentioned earlier, no urgent items, which just leaves me with item 11, date of next meeting, which is scheduled to be held on the 23rd of May 2024 at 10 a.m. So can I thank everyone for attending, and I'll close the meeting at 11:08. Thank you very much. Enjoy your